I'll be talking about a subject which is of immense importance in clinical medicine, and that is calculation of arterial blood gases. As any busy doctor would know, whether working in the medical department or in the intensive care unit, arterial blood gas estimation it dictates the treatment of a critically ill patient. For instance, if a young person comes with acute asthma, a ABG report will define whether this patient needs upgradation in treatment, thereby needing assisted ventilation, or the treatment can be downgraded and perhaps managed in the high dependency unit. But why are the ABGs so important? Well, the ABGs tell us about the general environment of the body. As the environment is necessary in a garden where the flowers grow, likewise environment is necessary in the body where the cells can remain healthy. So it gives us a glimpse into the overall functioning of various organs and the circulatory system of the body. It not only tells us about the circulation, but also about the cardiovascular, the respiratory, the renal, the gastrointestinal, and the hepatobiliary system. Um, Septicemia, which is one of the commonest presentations in medicine, is often relied upon by estimation of ABGs, and then it dictates how far we are going to take the treatment. Not uncommonly, ABGs are confused with a venous blood gas sample. So we know, and I think everybody who's worked in busy ERs, that not uncommonly a venous blood sample is also taken, and that can, unfortunately, it can dictate the treatment on the wrong side. First of all, I'm going to tell you the differences between an arterial blood gas measurement and the venous blood gas measurement. And then I'll take long and see that how can we be sure that the ABGs that we have in front of us are actually to be relied upon. Here I've got the normal values of the blood gas report. On the left side is the ABG, and on the right side is the VBG, that is a venous blood gas. And if you can see here 6 variables. You've got pH, PCO2, PO2, oxygen sats, bicarb, and base axis. You may or may not get all 6. You can get just 5. For instance, you may not get the oxygen sat value, but you will definitely get these 5 variables in the ABG report. That's pH, PCO2, PO2, bicarb, and base axis. PCO2 and PO2 tell us about the health of the respiratory system. The bicarb tells us about the presence of a buffer, which is the main buffer in the body, and indirectly tells us about the health of the liver. The base excess is calculated from these variables. Oxygen sat, undoubtedly, it goes with the PO2 as well. Now, if you see on the arterial side, the pH is 7.35 to 7.45. So the body makes sure that the pH remains in a very constant range. Anything less than 7.35 is called acidosis. Anything greater than 7.45 is called alkalosis. In the middle, we've got a value of 7.40, and I'll come to that in a minute, because 7.40 is in other words, called as the mean reading. And this mean reading is very important when we are going to make calculations. On the venous side, we see that there isn't much difference between the range of pH 7.33 to 7.46, and once again the middle probably will be about 7.40. So the pH is constant both on the arterial and the venous side. The PCO2 on the arterial side is 36 to 45 millimeters of mercury, and on the venous side is, as was expected, a bit higher, 46 to 51 millimeters of mercury. The PO2, 90 to 100 millimeters of mercury, and it's only 35 to 40 millimeters of mercury. Oxygen sats, 95% on the arterial side, but only 70 to 75% on the venous side. The bicarb is fairly equal, 22 to 26 and 24 to 28, and then base excess is dependent on bicarb. Now, you'll see that the main difference is between PCO2 and PO2, and oxygen sats and PO2, they're more or less they are interchangeable. PCO2 is higher on the venous side, and that's why it's so important to make sure that you are dealing with an arterial blood gas report, not a venous one. So when you get a report, don't just look at the pH, because the pH once again is fairly constant. A lot of the time this happens that you look at the pH and you think that it's an arterial blood gas, but you need to go down as well, and then you'll see that if we just rely on this one, we'll we'll make a diagnosis of hypoxia with CO2 retention, and obviously with very low oxygen sats. But if you go on this side, we'll see that this is a fairly constant. It's normal ABG report. The bicarb is another thing to note, and the bicarb, as I've said, this is the main buffer, the primary buffer, which is always present, and it's equal on both sides. So the body makes sure that the bicarb is constant on arterial and the venous side, and the pH is constant, because if the pH is less than this, then you're dealing with acidosis. The greater the acidosis, the less the cellular function. Potassium will be disturbed, and so the action potential will be disturbed. And if the action potential is disturbed, the skeletal muscles, the smooth muscles, and the cardiac muscles will cease to function. So the body makes sure that these two variables remain fairly constant. But how do we know that what we're dealing with is, in fact, a normal ABG report? We have a few formulas here. And the formula for that is pH is equal to pKa plus log base over acid. Obviously, it will be difficult because calculating the pK and the log, so it does become difficult. But this is the main formula. To simplify this formula, there's another way, and that is hydrogen ion concentration equals 24 multiplied by PCO2 divided by bicarb. This is something which you can calculate looking at your ABG report. But while we have this variable in a report, we have this variable in a report, we don't have this particular variable. So we don't really know what the hydrogen ion concentration really is. But there's another method of doing that, and that is hydrogen ion at a pH of 7.40. If you recall, I said 7.40 is important in our calculation, is going to be 40. You have to memorize this. So the hydrogen ions at a pH of 7.4 will be 40. Easier to remember, 40 and 40. For every 0.3 increase or decrease in pH, the hydrogen will double or halve. So this is interesting because it makes things a bit easier. Say for instance, if somebody had a pH of 7.10, so 7.10 is 0.3 lower than 7.40. So it's on the acidic side. So that means there are more hydrogen ions present. So this 40 is going to double. So the value of H becomes 80. If we take it further down to 6.8, again 0.3 lower, this is going to double again. So this becomes 160. Likewise, if the pH was 7.7 on the alkaline side, thereby meaning that there are less hydrogen ions, the value is going to halve. So from 40, it is going to become 20. And if we take it even higher, this is going to halve again to become 10. So on the acidic side, if it's 7.40, it's 40. If you increase or decrease by 0.3, if the pH fluctuates, then that's how you can add or subtract, doubling or halving the hydrogen ion values. And there's something which is easier to remember. But what if they don't actually fall in that category? What if they actually don't follow that rule of 0.3? Well, there's another way of doing it, and that is for every 0.01 change in pH, there is 1 millimole of hydrogen ion change. So if it was 7.50 on the alkaline side, we know that this is greater than 7.40. So this becomes 10. On the alkaline side, you're going to take out 10 hydrogen from the value. So that becomes, so if it's at pH of 7.40, it was 40. So going on the alkaline side, we've got another 10 which we need to take out. This becomes 30. So there's another way of doing it. But if you've got the pH which actually follows that principle, which is 0.3, you need to rely on that particular principle. And this way, you can calculate whether or not the pH actually uh, matches what you think. The further calculation from here is, now that we have an H value, we need to calculate this particular value. And they need to add up. For instance, if the hydrogen ion from here, from our calculation, if the hydrogen ion looking at the pH, if it's, for instance, a 40, because the pH is 7.40, this calculation, 24 PCO2 by bicarb, should equal to 40 or nearby. So therefore, anything which is 35 plus to 43 is acceptable. But if it's 30, then it's obviously it's a greater difference, so that will not be acceptable, but this range will be acceptable. Now let's put this to test. What I've got here is a few ABGs from patients who were admitted in the emergency department and they ended up in the intensive care unit. So I've got different values, and as you can see that here this looks a very, very abnormal ABG report. You've got gross acidosis, and then you've got PCO2 which is high. So there is, we know that there is a ventilatory problem, and this person was hypoxic because of a ventilatory issue. Let's put this particular report to test. In this one, the pH is 7.169. The PCO2 is 40.3 and the bicarb is 13.9. So we know that this is 7.169. This is on the acidic side. We'll just omit the 9. So this is 7.10. So if it was 7.10, which it was, then this, the hydrogen ion, if you remember, they would double. So we know this value comes to be 80 anyway, and then we add another 6 to that using this particular formula. So from the pH, the hydrogen value becomes 86. Now we have to see whether these equal that or not. So hydrogen 24 multiplied by PCO2 by bicarb. So we've got PCO2 is 40.3 divided by 13.9 multiplied by 24. So this value comes at 69. So there is a difference of 15 between these two. So sorry, 17 between these two. So this does not match. This particular report, it does not match because there is a difference. So 86 is equal to 69 and it does not match. So that means we can't rely on this one solely. We'll probably have to do another test, another ABG report. Then let's see another one. This is a different patient. Here the pH is 7.49. PCO2 is 32.5 and the bicarb is equal to 26.4. So with a pH of 7.49, a bit on the alkaline side, so that means you will take out the hydrogen ions. So if it's 7.49, 7.4 means 40 minus 9, so this becomes 31. because this was the alkaline side, so you need to take out the hydrogen. So this becomes 31. So the value of H is equal to 31. Now let's see if 31 can match this one. So the PCO2 value is 32.5 divided by 26.4 multiplied by 24. So this value comes at 29. So in this particular ABG report, this one, 31 equals 29. So this becomes a reliable report. You can rely on this particular report. I hope this makes it easier that when you get an ABG report, you can see the whether or not all the variables fit in together or not, and then we can further interpret this particular report. In summary, you've got 6 variables in an ABG report. Oxygen, sat, and PO2 are more or less the same. The most important ones are PCO2, PO2, and bicarb. PCO2 and PO2 tell us about the health of the cardiorespiratory system, and while the bicarb tells us about the health of the buffers. The buffers mainly they come from the kidneys and the liver, and they tell us about that. The bicarb value is constant on the arterial and the venous side, and the pH is more or less constant on the arterial and the venous side. But we have differences amongst the other variables because the body needs to maintain a similar environment on both sides for all the cells to function. Because the veins and the arteries, they're both present around the cells, so therefore you need a similar environment for both of them. So once we've done that, then we've found that what is acidosis, a pH of less than 7.35, alkalosis, pH of greater than 7.45. We need a mean pH 7.4 to make our calculation. When we get the report, we have to ensure that the report can be relied upon, and that's how you do it. You first of all calculate the hydrogen ions which will be present in this particular pH, which we did with 7.40. That's 40, which is a constant value. Any pH value greater or lower than 0.3, the hydrogen will double or halve. So if it's on the alkaline side, the hydrogen will halve. From 40 they'll become 20. If it's on the acidic side, they'll double. From 40 they'll become 80. Once we've calculated this particular value using this formula, hydrogen is equal to 24 by this formula, then we can see if they match or not. And then we have seen a couple of ABG reports. We have seen the one of the ABG reports, it doesn't match. So this value doesn't match. Then we saw another one, this more or less matches. So we are going to rely on the ABG report which matches instead of the ABG report which doesn't match. In the following videos, we'll go into more details about arterial blood gases, about compensation, the anion gap, etc. Thank you.